if you decide that someone's going to get a bone marrow transplant today, it's not really going to the operating room. It can be done at the bedside. Is that true?
Well, the donor is the one who may go to the operating room. The patient themselves doesn't. The donor, if they're going to donate bone marrow, would go to the operating room, and under sterile conditions, we would remove bone marrow from the hip bones. That bone marrow would be filtered to remove any small pieces of bone and fat, and then it's placed in a bag just the same as a blood bag for blood donation, and just infused into the patient intravenously. If you look at the bone marrow as containing seeds, and the bone marrow of the recipient being the garden or the soil, the seeds from the donor are just infused into the veins of the recipient. These seeds know where to go, just as if you throw seeds in the air, they land on the soil. They attach to sites in the bone marrow. They take root and give rise to the flowers or the blood cells. So it's a very simple process for the recipient from that standpoint. It's a little more arduous for the donor, but not necessarily. And now, with modern techniques, we could actually use the peripheral blood of donors to obtain stem cells. So not everybody has to have a marrow harvest.
We keep getting better and better at it, in other words.
We do keep getting. We've come a long way since 1950s, and we've come a very long way since the first successful transplants. And now, for many diseases, transplant survival and cures in close to 90% for diseases that prior to transplant would be very morbid or fatal.